So RDI, red dichromatic imaging, is useful in our practice to identify the source of bleeding. Predominantly in my practice, it can be useful when you have a field which is entirely covered in blood to identify the deep vessel that's causing the bleeding. The video that you see here is a polypectomy defect. It's 24-48 hours after procedure, and we've just removed the clot from the surface with a snare. You can see here that the RDI mode 1 really nicely shows that there's a large vessel there right now at the 4-5 o'clock, which is causing bleeding. And you can see that just with the red on the screen now, it's much more difficult to see that vessel. So I do think that for those people who have less experience with treating bleeding, less experience with the difficulties that can come from a field which is totally red and where you're searching for a bleeding point, that RDI mode 1 can be extremely helpful. I think a lot of that comes down to the psychological aspect of it. So as doctors, we are strongly influenced by the positive outcomes for patients. We want the patient to have a positive outcome. And of course, if we're not doing therapy all the time, then it can be a very intimidating situation when you enter in an acute situation and you are faced with the situation of doing something you don't always do, and you need to solve the problem because it's a life-threatening situation for the patient. And so anything that can help you in that situation is going to psychologically really be important for you as the practitioner, and I think therefore can really help you remain calm and really help your nerves be settled during a difficult procedure which is potentially life-threatening for the patient. So what do? You come in, you find a lot of blood, and you switch on RDI mode 1 that can nicely identify the predominant source of bleeding in that patient because the filter is applied in a situation where otherwise you may see red, and whereas you can see grades of yellow.